I'm Shay. I'm going to be your nurse today. How are you?
Good, how are you?
Great. I'm washing my hands. I've provided privacy. Do you mind to tell me your name and date of birth?
Adeline K. Thompson, October 1st, 2009.
Great. And I'm going to raise the bed to workable height. I see here that the tech took your vitals before you came back to the room.
Yes, ma'am, she did.
Do you mind telling me your name one more time?
Adeline K. Thompson.
Great. And can you tell me where you are?
I'm at the doctor's office
Do you know why you're here?
for a checkup.
And can you tell me today's date?
January 23rd, 2020.
Very good. And what would you like for me to call you?
Kate, please.
Kate? Okay, Miss Kate. So I did wash my hands, Miss Kate, but I'm actually going to put on a pair of gloves today. The first thing we're going to do today, Miss Kate, is we're going to check your eyes out. I noticed that you have glasses on.
Yes, ma'am.
And how often do you wear those glasses?
Every day.
Do you ever wear contacts?
No, ma'am.
No contacts? Okay, Miss Kate, do you ever have any issues with your eyes, any drainage?
No, ma'am.
No. Okay. I'm going to do a few checks with this. This is called a pen light. It's just a light I click it on. It has a little light on there. It does not hurt you at all. So if you would just do me a favor and look at my stethoscope, please. Very good. You're doing great. Thank you. So I'm going to turn that light off, and I'm actually going to move my pen in a funny pattern. I just need you to follow the end of my pen with your eyes without moving your head, please. And if you can follow the pen into your nose. Very good. If you can remove your glasses, please, Miss Cade. I'm going to check a few things with your eyes. Okay, they're very symmetrical. There's no signs of drainage. There's not any rolling in or out of the eyelids. And again, you stated, have you had any trouble with drainage?
No, ma'am.
Okay, Miss Cade, we're going to check your grip strength. So if you can grab a hold of my two fingers and squeeze as hard as you can, please really squeeze. Squeeze, squeeze, squeeze. Very good. All right, before you put those glasses back on, I'm going to take a look at your face. It's very symmetrical. Can you smile for me, Miss Cade? Very good. There's not any noticeable drooping on either side. Thank you. Also notice your speech is very clear, so you can go ahead and put those glasses back on. So the color of your skin is as it should be. I notice it to be fairly pale. The temp is normal. I'm going to just pinch on your collarbone. This is called tutoring. We're going to pinch it up just a little bit and let it go. And it responds in less than 1 second. Very good, Miss Cade. Do you currently have any lesions or cut on your body?
No.
No. Thank you. I'm actually going to just look in your hair a little bit. I noticed that you have even hair distribution, that your hair is a very good texture. I do not notice any signs of infestation. Your scalp feels as it should. I do not notice any open wounds. There are no lesions, no cuts, no break in the skin. The shape is normal. There's not any abnormal lumps or bumps. Thank you. Okay, Kate, can I have a look at your hands, please? Great. I'm actually going to check your capillary refills. They are great. They refill almost immediately, less than 1 second. Very good. Thank you, Kate.
You're welcome.
notice that you take very good care of your hands. Can I just take another quick look at those? There's not any noticeable signs of any abnormalities. Clubbing is not present. Again, the nails are in very good shape. They are very strong. Thank you. Okay, Cade, do you mind? I'm just going to see which side you breathe a little bit better out of. Very good. You seem to breathe great out of both sides. Do you currently have any abnormalities with your nose? Any issues with your nose that I should be aware of or the doctor should be aware of? No. Okay. And do you currently have any drainage from your nose?
No.
Okay. Do you have any difficulty swallowing, Cade?
No.
No. Okay, your lips look very good. They are pink in color. The skin is intact. Do you mind opening your mouth and saying, "Aw," please? Very good. The inside of your mouth is moist. It is pink. If you can stick your tongue back in, I'm just going to take a peek at your teeth. Can you smile for me, please? Very good. And can you open your mouth? Very good. Do you currently have any issues with any of your teeth?
No.
Perfect. Okay, and you did say that you do not have any difficulty swallowing as of right now?
Yes, ma'am.
Great. And I'm actually just going to feel around. Do you currently have any pain in your neck?
No, ma'am.
No. And have you ever noticed any swollen lymph nodes that I should be aware of?
No, ma'am.
No. Okay. I'm just going to feel on your neck, start around the ears and work my way forward. I'm actually going to stop on your carotid arteries, pressing gently. The pulse is normal. It is strong and even. Okay, and I do not notice any swollen lymph nodes. Okay, and I just want to make a notice that your trachea is in correct position. I notice that you do not currently have a scar. Have you ever had a tracheostomy in the past?
No, ma'am.
And do you have any strange, do you currently have a cough?
No, ma'am.
Do you have any drainage in your throat?
No, ma'am.
No. Do you use any oxygen?
No, ma'am.
Okay, I'm just going to take a look at your chest. It looks to be of the normal shape and size. And if you can just take a deep breath in for me, please. And slowly exhale that. Perfect. It expands and it contracts normally. Okay, and again, are you using any oxygen of any kind?
No, ma'am.
No. And are you experiencing any shortness of breath?
No, ma'am.
Okay, I'm actually going to take a listen to your lungs. So if you can just breathe normally for me. And I may ask you to take a couple of deep breaths from time to time. I'm going to start at the top and I'm going to work my way down. Very good. Your lungs sounds very clear. The rate and the rhythm is perfect of your lung sounds. And you did say, do you currently have a cough?
No.
Okay, the next thing I'm gonna do, Miss Cade, is I'm gonna listen to your heart sounds. Very good. Your heart sounds amazing. It's in very good regular sounds, a regular beat, and there's no history of a heart murmur?
Yes, ma'am. I mean, no, ma'am.
No, okay. Do you currently have a history of a heart murmur?
No, ma'am.
I'm actually going to go ahead and I'm going to check your radial pulses. This is just the pulse below your thumb. So I'm going to place 2 fingers here, and if you'll turn this hand over for me, I'm going to place 2 fingers here. Those are even, normal, and strong. I'm actually going to check for edema. 1, 2, 3, 4, 5. You have no signs of edema on the upper extremity, the left upper extremity. And you have no signs of edema on the upper right extremity. Okay, I'm going to ask you to please remove your socks. I'm just going to make note that there is even hair distribution to the lower extremities. I'm going to check, just like I checked your fingers, I'm going to check your toes for your cap refills. They respond quickly. And I'm going to do this foot as well, please. They are responding within less than a second and refilled very quickly. Okay, can you please, just like you gripped my fingers, you're gonna push on my hands. And I want you to also note while you're pushing, do you feel any pain in your calves?
No.
No pain in your calves. So that was the Homan test. There is no pain in either calf. I'm also going to check for your pulse on your foot. This is called Prialis pulse. They are strong, and they are normal, and bilateral lower extremities. The pedal pulses are normal and strong. Okay, Miss Cade, I'm just going to ask that you please lay back, flat on your back, please. So the first thing I'm going to do is I'm going to listen to your stomach. Is that okay?
Mm-hmm.
Okay. I'm going to listen for vowel sounds in all 4 quadrants. Perfect. You have positive vowel sounds in all 4 quadrants. The next thing I'm going to do is I'm going to press lightly on your stomach. If you feel any pain, I want you to tell me, please. So, we're pressing in the upper left quadrant, the lower left quadrant, the lower right quadrant. Are you currently feeling any pain?
No, ma'am.
No. Okay. So we've palpated in all 4 quadrants with no pain present. I notice that your stomach is soft and flat. with no pain present, correct?
Yes, ma'am.
Okay, Miss Cade, you can sit up for me, please. I just have a few more questions for you, and we're almost done here. When you need to go to the restroom, when you need to pee, do you know when you need to pee?
Yes.
Yes. And are you able to get to the restroom?
Yes, ma'am.
Do you ever have any accidents?
No, ma'am.
No. Okay, that's great. And when you do go to the restroom, is there any burning or any pain whenever you go pee in the bathroom?
No, ma'am.
No. I currently do not see a Foley catheter, but I do want to ask, do you ever use a catheter on your own?
No, ma'am.
No? Okay. And when you go to the restroom, what color is your pee?
Yellow.
Yellow? Is it is it clear? Is it cloudy?
No, ma'am.
No? Okay. Is it clear?
Yes, ma'am.
And is there any abnormal odor, anything different about the smell of the pee?
No, ma'am.
And Miss Kate, can you tell me the last time you had a bowel movement?
This morning.
This morning?
Yes, ma'am.
And about how often do you have bowel movements?
Every day.
Every day?
Yes, ma'am.
And was this morning's normal?
Yes, ma'am.
Do you currently use an ostomy bag of any kind?
No, ma'am.
Okay, Miss Cade, I'm just going to take a look at your alignment and your posture. Your posture looks great. You're sitting up straight, capable of sitting up straight. There's not any abnormal curves in the spine. You look very strong. Are you experiencing any weakness?
No, ma'am.
And I noticed that you are symmetrically strong. Do you have any weakness on either side more than the other?
No, ma'am.
Okay. Do you currently have any weakness in either your upper extremities, which would be your arms, or do you have any weaknesses in your lower extremities that would be your legs?
No, ma'am.
No. And do you currently use any devices that help you walk? Do you use a walker or a cane to help you walk?
No, ma'am.
No? Okay. And Miss Cade, when you're home or you're out places, do you need help to walk around?
No, ma'am.
You are able to walk on your own?
Yes, ma'am.
Okay. I don't notice any IV sites, but I do want to ask, do you currently have any IV sites present on your body?
No, ma'am.
Okay. And Miss Cade, I know that I don't see any dressings that looks like you take care of. Do you have any dressings on your body that I need to know about?
No.
Okay. And do you use any safety devices?
No, ma'am.
No, I do not see any safety devices present. There are no alarms. There's no any vests, anything that's holding any arms in place, any extremities in place. And Cade, do you have any new complaints that you would like to talk to the doctor about today?
No, ma'am.
Okay. I'm now going to lower the bed in low position. I am going to keep the call light in reach. I'm going to raise the side rails ×2. I'm going to wash my hands. I'm going to clean my equipment. And then I'm going to document all of the discussion that Miss Cade and I had today.